friends, hello family, hello diabetes. I'm back and welcome back to my YouTube channel. I know I don't think it has been that long actually. I feel like I'm getting better. I'm not as consistent as I would like to be, but at least we're getting somewhere. So anyway, today we're here to talk about something I think is it's a bit of a taboo, especially in my community. I can't speak for everyone else. By the way, ghetto, I know. But I can't speak for everybody else, but I'll speak for my community when I say it's a bit of a taboo. We are going to be talking about the 5 symptoms of diabetes. It's actually an idea I got from my TikTok. I've always wanted to talk about this topic, but somebody else mentioned it on my comments on TikTok. So I'm going to put that person's name over here. And thank you for opening up the discussion. I think I'm also going to post like a short video on my TikTok explaining what I'm talking about here today on my YouTube as well for people that are not subscribed. By the way, if you're not subscribed to my channel, what are you doing? Okay, I gave you a moment to think about it, so do better. So yeah, I just decided to come on here cozy, no makeup, to talk about this because I feel like, yeah, it's like a, a sister to sister conversation. I'm being very vulnerable with you guys. I haven't really told my diagnosis story on here, which is something I'm going to do. I feel like it's like the grand special story that I'm going to drop. And also, I'm actually at a point where I can talk about it without crying. So that's good, because it's been a long time coming. The people that know me before I got my diagnosis know how difficult it was. Just the journey leading up to the diagnosis, how miserable, and it was just, yeah, would not recommend. But yeah, so today I'm here to share about one of the symptoms that I had before I was diagnosed, and had no idea that it means that I had diabetes, right? Okay, let's talk about vaginal thrush. As I was saying, we're here to talk about thrush, but the medical definition of what we're talking about today is a vaginal yeast infection. So this type of infection, I'm going to read here from Google. It says it causes irritation, discharge, and itching of the vagina and the vulva. This vaginal yeast infection is also called vaginal candidiasis, right? Candida, vaginal candida. Vaginal yeast infection affects most people assigned female at birth at some point in their life. But we all know that if you are diabetic, it means that you're more prevalent to having a vaginal yeast infection. This is because when we are diabetic, right? What happens is that we have a lot of glucose in the system. So when the glucose is just too much in the system, what usually happens is that let me start here. I'm realizing I'm jumping all over the place. So we all have healthy bacteria, right? In our bodies, we have healthy bacteria, and we have bacteria that comes in that is not healthy. And usually the white blood cells will try to deal with that bacteria and fight it, right? So with the good kind of bacteria, it's only supposed to be a certain level of a percentage. Yeah, well, think of it as too much of a good thing is not good, right? So emzimeni umzimba wakho has good bacteria, and this bacteria is called candida. So you have this bacteria in your vagina, and it's just there, it's healthy, it's not being bothered by anything. So you can imagine and you have too much glucose and your sugar is uncontrolled, and it's just too much glucose in the system. Candida, so what happens is that Candida thrives in an environment where there's too much glucose. So because you're passing a lot of urine, we know that the 5 symptoms are hunger, thirst that cannot be quenched, passing a lot of urine, eating not eating, but so it's hunger, passing urine. So it's also fatigue, and the last one is losing weight, right? So as you're drinking this like large amount of water and you're passing a lot of urine, that means that also the urine has to come out through the vagina, right? So the candida can also get a little taste of the glucose, and it's like, okay, it multiplies. So now there's an overgrowth of the candida, which is something that we don't want. So where before I was diagnosed, I had that and I had no idea what it was. And coming from a very staunch Christian background, I was like panicking and I didn't tell anyone, and I was like, oh my gosh, what is going on with my body? And I was just uncomfortable starting the conversation with umuntu omdala kunami. So I remember going to a cliques near me. I was at university at the time, and I went to a cliques, and I'm like to this guy, hey, this is what I'm experiencing. And I'm trying to explain to him. He's like, what are you talking about? And I remember he couldn't prescribe anything to me, and he took me to a section that till this day I will not tell you guys where he took me. And yeah, I got something that did not help me because at the time I was undiagnosed. And trust me, I had all the symptoms, like from number 1 to number 5. I had all the symptoms. The symptoms were there, but I had no idea what vaginal thrush was. I had no idea what a yeast infection. I had no idea what my body was trying to tell me. And my body literally told me all the signs. And it got to a point where I was so depressed because I had no one to talk to and no one to turn to. And for me, my biggest fear was that like my parents would be like, hey, siyanga, yakanga lingani, you know, and not knowing that when I got diagnosed, I remember I was still at the ICU, and the doctors and the nurses were explaining to my parents like uh what the symptoms were. They, like trying to get a feel as to like, did I have those symptoms, or and I remember somebody mentioned a yeast infection, and my mom was like, I don't think she's ever had that. And in my head, I'm like, girl, I did. So I look at her and she sees that, it's something that I've experienced before. And I remember she said to me, why didn't you tell me? Why didn't you tell me that you were experiencing something like this? Because I would have known that it's diabetes, because the women around me sometimes struggle with yeast infections as well, and they are diabetic. And in that moment, I felt so sad because I was like, I should have asked for help and I didn't. But anyway, I'm here to tell you guys about it so that you don't go through the same thing I went through. So you don't have to suffer in silence. And I don't want to lie, I was suffering. At some point, I was very depressed. I did not know how to like be normal like other people. I just was going through a lot of pain and discomfort. And for me, this was every day. And I had no solution. I didn't know that you could go and literally over the counter, you don't need a prescription. You can go and get a cream that can help you. And most importantly, I didn't know that I was diabetic, because it also has to do with your blood sugar control. If your sugar is always high, then that means you have a higher chance of getting a yeast infection, because like I said, when there's too much glucose in the system, the candida thrives. So yeah, I'm hoping that this video is gonna help somebody out there to, number one, ask for help. I know it's very uncomfortable. Like I didn't even I was I was literally like contemplating if I should do this video or not. But I was contemplating if I should do this video or not, and I was a bit uncomfortable because like I didn't want to come on here and bring up topics that will make other people feel uncomfortable. But this has come up a lot now, especially with the patients that I see sometimes when I'm doing my advocacy work. Most of them are teenagers, my babies, but they always bring this up. And sometimes for them it's uncomfortable to bring it up. And then I'll bring it up first so that they don't feel uncomfortable. And majority of them don't know that this can be treatable with just an over-the-counter ointment. Or is it a cream? Cream, I don't know, don't quote me. But yeah, I'll give you the name of the cream at the end of the video. Hopefully I can even insert like a picture somewhere here so you guys can see what I'm talking about, and you can actually go to the pharmacist and ask them for this cream, and it works wonders. But obviously it won't work if your sugar is still high, so you need to help it bring your sugars down and also use the cream, so it works hand in hand, just like that, right? Okay. So now let's talk about the symptoms of vaginal yeast infection. The first symptom that you're going to see is abnormal discharge. Your discharge will be watery, but a type of watery that is very watery. And the color will maybe be white. It's like white, and then sometimes it'll have like clumps that look like cottage cheese. So I know it's like it's TMI, but anyway, if you're on this channel, you already know that we're talking about health stuff and we're talking about diabetes related stuff. So if you don't want to be a part of it, you can click off right now. But if you know somebody that needs to hear this information, please share this video. And please, yeah, just like, subscribe, and comment below if you've ever experienced this before. So yeah, so it's abnormal discharge. So the discharge can be watery, or it can be watery and then it can have like clumps, white clumps that look like cottage cheese. And you can also have feelings of like burning and itching in your vagina. That could also mean that you have thrush. So you can also experience pain while taking a wee. So if you are in the toilet and you are having a wee and you feel like a burning sensation or the pain or the itching, then it could mean that you have vaginal thrush. So you can have redness. The last one is redness and swelling around the vulva, which can also cause discomfort if you're wearing underwear or any type of clothing. So yeah, these are the symptoms. You have to look out for the redness and the swelling. If you have burning while urinating, if you have itching, and just a sensation nje ngathi ungalokhu unwaya nje, yabo, but munwaya iba worse, then it's definitely yeast infection. So, and last big symptom is the discharge. The discharge will tell you everything you need to know. If you have white clumpy discharge, if it's slightly watery and it's white, the color is important as well. It's just white. So even if you have oral thrush, because I know there are some people that have oral thrush as well, you will see it ngomlomo, like your tongue will be very white, and like the inside of your mouth will be white as well. So yeah, those are the symptoms to look out for. It's nothing to be ashamed of. I promise you, it's nothing to be ashamed of. And if you seek for help, you will actually realize, you'll discover that there are a lot more people that are going through the same thing that you are going through. There's nothing new under the sun. This is something that I have discovered in this journey. And there's nothing I'm ashamed of anymore. This is just me finding ways to take care of my body and to know my body better, because when you're living with a chronic condition, it's daily learning. You wake up every day and there's something new that you have to learn. Something new that you have to learn, and you're doing this so you can show up for your body in a better way. You learn new ways to take care of yourself and show up for your body and to fight for your health, because if you're not operating in your prime, then you're definitely robbing the people around you and yourself of a good quality life, you know. So yeah, before I go, I want you guys to know that you need to go see a doctor so they can make a proper diagnosis. And sometimes what they can do, they can give you antibiotics. So those antibiotics, it depends if you have to insert them somewhere or you take them orally. It just depends. But bottom line is that you need to see a doctor so they can be able to find out if you need antibiotics or you can just take the over-the-counter stuff for yourself. So it's important. Go see a doctor, because sometimes it goes away on its own, sometimes it does not. Most of the time it does not go away on its own. And please don't use home remedies like yogurt, and just go to your doctor or get it over the counter. It's gonna help you, I promise. And also, do not forget to take care of yourself, take care of your sugars. If you do not take care of your glucose levels, it will keep coming back. Is a boy, like is a boy, trust me, it's gonna come back every 2 weeks, every 2 days, every 3 days, if you don't take care of your glucose levels. So this is important. You can take the over the counter and the antibiotics, and but bottom line at the end of the day is that you need to keep your sugars in control. But yeah, guys, before I close this video, I just want to say that if you have experienced something like this and you don't know where to start, and you're a bit I don't know, you're like me, you have no one to talk to, I would advise that you go see a pharmacist and see a doctor. See a doctor first. But if you do not have access to a doctor, you can just go straight to your nearest Clicks or Discam and go ask them for a cream called Canix V. I'm not prescribing this to you, I'm just giving you tips. I'm just here to give out tips because these are things that have worked for me, and I'm sure they can work for you as well. But this is not medical advice. Take it, don't take it. But you can get this cream at Clicks, and it's only 25 rands or 23 rands. I'm not sure. It's very cheap. You just read the leaflet, and it will tell you how long you have to use for, how you have to use it, and I'm hoping this video helps someone to know that you're not alone. We are here with you. Some of us are in the shadows. We will never come out. Some of us are brave enough to come out and to just let you guys know that, yeah, we are here. We are going to conquer this at some point. But for now, we are here for it. We're here for the fight. We're here to be resilient, and we are here to not give up. I know what it's like to have an invincible disease where people cannot see what's going on the inside. You can be in a room full of people and everybody's laughing, and you just have a moment where you're like, what the heck is going on with my body? And I've had tons of those moments where I just don't understand why me, but what keeps me going is the fact that for as long as there's a will, there's a way. And the more I find out, or the more I learn about my body, and the more I get access to resources and information and knowledge, the more I feel like there's still a chance for me to fight for a better quality of life. So I hope this video makes you want to stand up and fight. I know people like saying abantu abanoshukela banoconsi, that we have like inhliziyo encane. How do I say that in English? Yeah, but we're quick to be irritable. But I think it's because nobody truly knows what it's like to be us. How do you explain to someone that you constantly have to fight infections that are caused by your high glucose levels that may be affected by stress hormones, what you eat, your emotions, sometimes the weather, medication. It can be affected by your illnesses. If you have a flu, your glucose levels may be high, and that can trigger an infection. So now you're dealing with an infection that was caused by your high glucose, and now you're dealing with high sugars that were caused by medication or the illness. So now it's like a ripple effect of things that you have to deal with, and you're just one person, but I think this condition forces you to appreciate your body a bit better, and not only appreciate it, but to learn to listen to it and give it what it needs. So yeah, this video is just to say, hey, also, let's stop making such topics a taboo, because if I'm seeing an 11-year-old and they are dealing with something like thrush and they are scared to talk about it, and they have it for a long time and they've had it for the longest time, and it's starting to affect their mental health, and if they come to and see me and they are scared to talk about such things, then that means as a society, as a people, we are robbing that child of the opportunity to fight for a better quality of life, and we are robbing the child the opportunity to cry out for help. So yeah, I'm hoping we can do better as a society. And if you're watching this and you're not diabetic, just go and hug your diabetic grandmother or grandfather or anyone that you know that's diabetic. Hug them and let them know that it's okay. And if you're a mother of a diabetic little girl or boy, just let them know that once, if this happens to them, and at some point, if they ever feel like you're not approachable or they're scared to talk to you, just let them know it's okay. Let them know that you're here to support them, and just start teaching them that if they see such signs, like if they start seeing these changes in their bodies, that there's always help. Because I thought that I was beyond help. I thought there was absolutely no way that I was going through something like this, and I went to each and every pharmacist I could find, and I still didn't receive the help that I felt like I needed at the time. It was only after my diagnosis that I got the help, and I got to understand what was happening with my body and what my body needed from me. So yeah, anyway, I need to go now. This was just a heart to heart that I felt like I needed to have with my family, my dia family. So yeah, guys, so I hope you guys are having an amazing Diabetes Awareness Month. I hope everybody is painting the world blue, and you guys are making noise, and you're making people more aware of diabetes, because diabetes is the #1 killer in South Africa at this current moment. And I feel like we don't have enough time to be busy cowering and not starting enough conversations about this. We need to stand up, we need to speak up, we need to make as much noise as we can about this. And anyway, love you guys. I hope you will like, subscribe, comment, and share the video with your loved ones. And I will see you in the next video. Una con que luego